Hi guys, Dr. Markov is here, double board certified plastic surgeon. So today we're gonna talk about the options after the removal of the breast implant. If you decide to remove your breast implant for whatever reason, because of the symptoms, because of the rupture, because of the capsule formation, and you decide not to replace the implant, what options do you have? Well, there are several possibilities. Option number one is do nothing. And I get a lot of patients like this who said, okay, well, I had a good run with my implants, and for now my life circumstances changed and my attitude towards the implants changed, so I want them to be removed. And that's totally normal. Patient decides to put them in, and the patient can change their mind and they can decide to have the implants out. What happens in this instance, we can proceed with the removal of the implants most commonly under local anesthesia. There's no need to go under general anesthesia for the implant removal. So the patient gets in our procedure room, we get the wall numbed up, and you can watch our other videos about the implant removal, and we just proceed with the removal of the implants. What happens with the capsule all depends. There's a little shell that your body always forms around any foreign material, and the implant is a foreign material. So if your capsule is thickened, if you have certain symptoms, if you have calcifications, then the capsule is being removed. If it's a thin, normal looking capsule, frequently after discussion with the patient, we decide to leave it behind just so the procedure is less invasive. I rarely use any drain or plastic tubes to drain that cavity, because with our special protocols and suturing, we're usually able to avoid the need for the drain. Well, what happens with the breast afterwards? Well, initially, as I tell my patients, it can look pretty sad, because you have the implants, you have a lot of fullness in your breast, and when you remove the implants, the breasts appear to be deflated. What I've noticed that after a couple of days and weeks, your breast tissue expands a little bit, because the implant causes pressure on your native breast tissue, on the muscle if it's placed under the muscle, and the tissues thin out over time. And when we remove the implant, we remove the pressure from the tissues, they expand a little bit. Obviously not to the point of original state and having the implant, but it looks a little bit better a few days later. The younger you are, the better your skin elasticity, the more stretchable your skin is, the skin is more elastic, and that helps for your breast to recoil back to closer to the original state. And I've had very young patients who decided they don't want the breast implants anymore, where you take the implants and the breasts look pretty close to the original state. The older you become, if you had implants for a longer period of time, then obviously over time with the gravity, skin gets stretched. Also with the pregnancy, so when you remove the implants, your breast droopiness or breast ptosis can look worse. And some patients are not bothered by it. They said, well, it looks natural, and they elect not to proceed with any additional procedures after that. They just want simple removal. So the younger you are, if you had the implants for a shorter period of time, the closer your breast will be to the original state, although it's rarely back to exact original state. And the older you are, if you had implants for a very long period of time, likely you'll have some looseness of the skin and some breast droopiness. Now, what can you do about that? Do you have to live like this? Well, the answer is no, and a lot of patients elect to proceed with the breast lift procedure or Mastopexy procedure at the same time, at the time of the implant removal. In this situation, we make additional incisions on the breast, and we work with the breast tissue to rearrange it to create much smaller after the removal of the implants, but curved looking breasts. So we address that droop, we address that extra loose skin. It can also help to make your size of your areolas, to make them smaller. It can help with that. That procedure adds up a little bit of a surgical time, obviously, but also adds up to the recovery a little bit, because there are extra incisions of the breast. For the smaller breast, also can be done in the local anesthesia. For the larger breast, it requires IV sedation or general anesthesia. This procedure comes with the additional scar burden. So usually I do my breast lifts through a shorter scar, so it's a lollipop scar. So it's a scar around the areola, which nobody really sees. It's kind of a junction of the pigmented skin and the healthy skin. So when it heals up, you can hardly see it, and it can help make your areola smaller, as I said. And there's a vertical component to it, which will fade away over time, but it is a visible scar. A lot of times when it's necessary, and it depends on the technique, you can have a scar in the crease under the breast. That one is also kind of hidden, but I try to avoid that scar for majority of my patients. And the third option is, after you're done with the removal of the breast implants, is fat transfer. I am not a fan of doing fat transfer or replenishing that volume at the time of the removal. And the reason is the fat has the consistency of an applesauce. It's liquidy. So when we harvest the fat via liposuction procedure, we have that fat which we can inject in the breast parenchyma and around the breast to help to augment the breast and make them look fuller. Usually it's not to the point of the implants. I tell the patients usually about a cup size difference, but it helps to add additional volume. The reason I do not recommend to do it at the same time with the removal, because after the removal you end up with that large empty space from the removal of the implant. And if you're not careful enough when injecting the fat can potentially go into that empty space, fill it up, and the fat is not going to survive. In order for the fat cells to survive in your breast, they have to be placed and placed strategically between your healthy tissue so that fat graft can get the vascularization, the blood supply, and can survive in your tissues. So usually I recommend the patients to heal from the removal, and then we proceed with the fat transfer as a separate procedure. That can be done under local anesthesia, relatively easily tolerated procedure, and that procedure can help to augment your breast. This procedure will not eliminate the breast droop completely. Okay, it can make it look a little bit better, but if you have significant droopiness, significant looseness of the skin, you will need the breast lift prior to that. So it can be that we do the removal and the breast lift followed by the fat transfer to give a little bit more volume to the breast in a natural way without the use of the implant afterwards. So here are your options after the implant removal. Do nothing breast lift or mastopexy, or as a subsequent procedure fat transfer to augment your breast with the volume. I hope you find this video helpful. Click like the button and subscribe below. See you soon.